Hi, Ben here. With my wife, we are driving to go and see Dr. Sassani. He was the surgeon that performed my top surgery about 16 months ago now. So we're checking in with him to make sure everything's looking good. There were a couple things I did want to run by him. One of them being that my nipples, everything looks fine. Everything seems to be working fine. Obviously, I'm still very numb in those areas, like I can't feel anything, but every now and then I can squeeze my nipples and it's almost like not pus, but like a pimples being popped kind of thing. It's very little, so that's something that I'm concerned about. I'm going to be talking to him about, just making sure that that's like a normal thing or something that will go away in time, or if that's something I need to put an ointment on. I don't know. We'll definitely see. So alright, we're here. We've just arrived to go and see the doctor. So and get out of the car. After I never mind. Just go.
Love you.
Oh, I've not been doing that. It's okay. Hello. Give a pen. Awesome. Same only. Appointment. Okay, thank you. Is that getting close?
Cool story, bro.
Maybe I should get a whole tummy test.
No, your tummy is perfect.
You like all this tummy?
It's not that much tummy.
That's a lot of tummy.
I feel like you're being dramatic.
Thank you.
Thank you, puppy.
Hey.
Hi, how
What's
are
up?
you?
Hi.
Sorry, can I talk to you for a minute? Is that okay?
Oh my god, you guys.
Hi, how you doing?
How are you?
Whoa, so good.
Look at you.
Hi. Good to see you.
Good to see you again. So guess what?
What?
I'm transitioning. I'm doing hormones now. Like
You
hormones
are?
now. Yeah.
You look so different.
A little bit, right? It's only been, actually I just took, this week was 12 weeks. So
You look so different. You probably don't notice it because every day.
she doesn't notice it.
I
I told her
mean,
my voice has gotten deeper. She's like, it hasn't. And then sometimes I'll wake up
It
in the morning
has.
just to mess with her and be like, I think my voice has gotten deeper today.
it's true.
Very
It's true. He
different.
does that all the time.
Very different.
Yeah.
I was
get
like,
a little bit of this going on
Mm-hmm.
and stuff, but finally kind of came into it, and
and this
was, like,
one's
ready
still
for it.
in the little dresses. She's so
of course. all the
It was
little
just-
dresses,
cute. I can't even deal.
by the
You
way,
moved where?
as usual.
I can't
We went up to
search.
Arkansas for a year,
Mhm.
and then I quit my job. And
Yeah.
I'm moving back down to Orlando, but we're gonna travel for the next 2 months first. We're going to Mexico, and then we're gonna bounce around Europe for a little while.
You know.
Did you get a shirt?
Did I get a shirt?
Large? You're large?
No, I didn't. I never got a shirt from you guys. Oh, that's awesome.
Do you wear large?
Yeah, I'm a medium, large, whatever.
Wow.
I'll be a large, it's fine.
No, I can give
We'll
you a
hold it
medium.
up to you. See,
I'll probably
see.
shrink in the. Yeah,
I
this
would
is
get a
fine.
large.
It'll get a little small when I wash
That's
it.
perfect. Let's see, puppy.
Right?
Oh, you look so good.
Oh, it's
What's
awesome.
that?
Love it.
So
So,
you guys are back. That's good.
yeah. And it took me about a year of not having breasts and finally being comfortable with myself away from my family, which was really what was holding me back. To realize this is what I want.
That, you can't choose your people. You know what I mean?
Mhm.
Your tribe is your tribe, and they're different from me.
Yeah. I just don't want to really be around anything that's going to be negative.
Exactly.
You know what I'm saying? Like, if you're
There's
not
nothing wrong with
contributing to my life positively or not, being supportive or whatever, then what's the point? Blood or no blood?
that.
Yeah.
I'm the same.
Yeah, they'll get over it. Whatever. And if they don't, then whatever, screw 'em.
We
Well,
live
I-
believing that the most important people are our parents and our siblings.
Yeah.
But a lot of times it doesn't work out like that,
No.
you know?
You
Closer to
create
my
your own
cousins
family,
than I
right?
am to my siblings. I'm I was closer to my grandparents than to my parents. Like, it's just the way that it is. Like,
You choose your own family.
you go where you're happy. You go where you feel respected and
Loved,
and that's it.
Supported, and that's it. Yeah,
Mm-hmm.
absolutely. Well, it was great seeing you.
You
I
guys
wanted to
come to
pop
my
in
house.
and yeah, absolutely.
Where are you going? What room are they?
Don't know that
This
one.
way.
First
Thank
off,
you.
yeah.
Wow, I'm so happy I got to see you guys.
Yeah, you gonna see the?
I forgot.
That's what I got going on.
Come in.
I have to come all the way to this side to keep doing this. But don't worry, it's only for a little bit.
It's stretched a little bit.
Yeah, and I think I remember how I did that.
You know you remember how you did that.
She
I
remembers
was
everything.
obviously bedridden for a little while, and when it was healing, and I was just really playful, but I couldn't move, and I was trying to tickle her, and like. I
He
remember
ended
I
up
was like, "Ah!"
stretching his arm up too far to tickle me.
No.
She
And
was like, "That's what you get."
because I was trying to get
No.
away from him and he was holding me down to tickle me.
I'm starting to break out here because of the testosterone,
Yeah.
but I think that's because that's
The
where the hair's
results
gonna probably
are
come
great.
out. So my follicles are probably all like irritated and stuff.
Because it's happening on his hands and stuff too.
Yeah, here.
Really?
Yeah. My hair's coming in.
Hi, how are you?
Hi.
Great to see you.
Good to see you again. Yeah.
Hi.
My wife.
Hi.
and I.
Leland wanted to talk to you when you're ready. Hi.
Hi.
Great to see you.
Good to
wants to
see you.
talk to me?
Do you mind if we?
Leland is right here.
Oh, okay.
Yeah, no, absolutely.
Are you
Yes.
Leland?
Yes.
Oh,
Great
it's
seeing you
so
again.
good seeing you guys.
Good.
So you're on T now?
I am Latina. How did you know? Did you just tell?
Because you look different.
I look a little manly.
Yes. look-
Yeah, I just started. This week was actually my 12th week,
Okay,
so
nice.
it's still pretty new.
Good.
But yeah, it's like finally a year away from my parents and without my breasts. I just kind of came into myself. Like this
Awesome.
is. I realized this is really what I want to do.
Minute
Good for you.
pass between
Awesome.
you
Just
guys.
taking baby steps to it is what it was. Oh. Well, there we go. So who knows? I actually haven't talked to them in a while just because we've been so busy traveling and
Right.
back and forth. And we're actually about to go to the country and travel for the next 2 months. So
All
that's
right.
why I'm recording because I started a YouTube channel
Okay.
to kind of record my transition and then traveling while I'm transitioning too, which I thought would kind of be an interesting
Yeah,
segment.
wow, that's great.
So
So you have your own YouTube channel?
yes,
Okay, that's-
do obviously do a shout out to Dr. Sassani.
Okay, cool.
So,
Hi, everybody. Here I am. Florida.
you want to see?
Sure,
Take
absolutely.
a look at it. I know
Absolutely.
we were supposed to
Thanks
do a
a lot.
follow up right after the surgery, and then we
Yeah.
ended up just leaving after that. So I think you ever really
Where
got
did you
to
leave
see
to go
it.
to?
We went to Arkansas
Oh
for a
my
year.
gosh, yeah, it looks great. I mean, the scars are a little bit thick right here, but not too bad.
Mm-hmm.
Widened out. Nipples are in good position. I
Mm-hmm.
think we should take your longer term post-op pictures as well.
Yeah.
Yeah.
Okay.
Yeah, everything looks perfect.
Perfect.
Yeah, it's good.
There was
good,
one-
good symmetry.
There's one question I had.
Yes.
So not shortly after the surgery, maybe a few months after, while it was healing and stuff, I noticed that some stuff will kind of come out of here. Like I've been expelling whatever's in there, so it doesn't really happen that much often. But you see, like
That's
stuff
totally
will come out.
not unusual. I mean, there is a little bit of glandular tissue that's still not glandular tissue, but ductal tissue actually in the nipple itself.
Oh really?
So
So
that
yeah, that's just coming out.
correct.
Because at first it created like a bubble, and I was like, whoa, what is this? And she was like, don't pop it. And of course I was like, couldn't help myself. Because I'm like that. And I popped it, and there was a lot that came out. But now it's like, if I do it, whenever I do it, it's just very, very little bit, hardly
Okay.
anything.
Okay. It's still just a little bit full across here too, but we'll see what happens with continuing exercise.
Exercise
Yeah.
and the testosterone, that stuff should
Yeah, you'll bulk up.
bulk up a little
yeah,
bit.
Yeah, yeah. Are you doing
Hopefully.
any chest exercises at this
Not
point?
yet. I actually haven't really been working out. Just because we've been trying to move back down here.
We got married in
We got married in
October.
October. There's a lot been going on, and we've both been working full time.
It's been a
Wow.
busy
So
year.
it's been kind of crazy, but traveling I think will help because we're planning on doing a lot of hiking and biking and
Okay,
climbing
sure.
and
Yeah.
doing that,
So
eating
you'll be out of the
healthier.
country in Europe or South America?
We're
or-
going to Mexico first for
Mexico?
a few weeks,
Okay, good.
and then we are popping up to Europe, and we're going to be bouncing around Europe for about a month.
Okay, great. Wow.
So
I'm
we plan on going to
envious.
Scotland, Ireland, Amsterdam,
Nice.
Spain, France. So
Beautiful.
yeah, we're really excited about it. I've never been out of the United States, so
Oh, wow.
I'm
You're in for a
27 years
treat.
old. This is on my bucket list. I got to do it.
Yeah, you're in for a treat.
Before I hit
Now's
30.
the time to do it.
Yes.
Before you settle down into a job. or-
Exactly,
yeah.
before I try to find a new job, and
Right.
now I'm going by male pronouns and all that stuff. So I think it'd be easier, the transition at least, to take a little couple month break, kind of settle into the hormones and all that,
Right.
travel while we're doing that, and then kind of come back to it
Wow,
and
that's
settle
awesome.
down here
Wow.
for Orlando, really.
And change your gender legally, change your
Yeah,
name
we're
legally.
planning on doing that. We're gonna do that after traveling though, because
Okay.
I already have my passport that has my. It would take too long to try to do that before traveling.
Okay.
So
So it has your old pronoun on it.
it has, yeah. So I'm still female. My name legally still is Vanessa, right?
Okay.
But the reason why we kind of kept everything as it was is because we're literally traveling in a week or two or something like that.
Okay.
And because of the wedding, we didn't have to, and working full time.
It's hard.
It's a long
a lot,
process because
yeah.
you gotta apply
It's a lot,
for it. You
yeah.
gotta wait till the social security card comes in. Then you gotta go and get the ID. And then once you have the ID, then you gotta apply for the passport. It's like a
Long
month long
process.
thing, I
Right.
think. So
Now,
we wait till we
we
get back.
gave you gender marker letters though, right?
Yes, and we have that with us to carry with the passports.
If
Yeah.
you need more, just
Make
let
sure.
us know. We can always, write up some more for you.
Yeah, absolutely. Well,
We look
I plan
great.
on shaving before we get on the plane, so my face still somewhat looks like my passport. But
Well, and how old is your passport picture?
it's still
It's pretty
new, but it
fresh.
was just before I started taking the hormones,
Oh,
so I
gotcha.
didn't really have facial hair or anything like that.
Okay, right.
So I just have to shave every time I get on a plane.
right.
That's cool.
And your
Whatever.
hair's a little shorter.
Oh yeah, my hair's a little shorter, but awesome. Thank you so much, doctor. I really appreciate it.
Absolutely.
Thank
Absolutely.
you so much for your help.
I'm happy for you.